Hello, everyone. Welcome and thank you for joining today's program. I am Lori Smetanka. I am the Executive Director of the National Consumer Voice for Quality Long-Term Care. And we, along with our partners at AARP, are hosting this briefing for Congressional staff. Also listening into today's program are representatives from national stakeholders organizations, AARP state offices, and members of Consumer Voices Network, which include residents, families, long-term care ombudsmen, and citizen advocates. A few housekeeping items as we get started for today and people are logging into the program. First of all, as you heard when you logged in, today's program is being recorded. All participant lines will be muted throughout the program today. You can post any questions into the Q&A box on your control panel, and we will pose them after the panelists have made their remarks. We ask that you identify your office or organization when asking a question so that we can follow up, although we will not be identifying your name when we ask the question. We will just ask the question generically. There is not a PowerPoint today. However, speaker remarks will be shared in an email afterwards, along with the recording of today's program. And the program and remarks will also be posted on our websites and will be shared through other channels. So we're really glad that you're able to join us today. So the purpose of having the briefing today is to really draw attention to the critical need to address inadequate staffing that exists in nursing homes. The problems with inadequate staffing are not new, and we should not be surprised that we're finding ourselves in a crisis situation nationwide as short staffing in facilities has reached critical levels. There are no federal minimum staffing standards in place other than a vague requirement for sufficient staff, and we know that has not been something that's worked. When Consumer Voice even looked at state staffing standards, thinking, well, we don't have a federal staffing standard, let's look at what the states are requiring. We found in a report last year that those standards are inadequate as well and don't come close to the recommended 4.1 hours per resident day that research and good practice has shown is the minimum below which we should not go in order to prevent residents from experiencing harm. So it's really important that we focus on the need for good staffing. There's lots of support for that, and we're going to be talking about that today. The other piece of it, though, is we really need to focus on accountability and transparency, both of ownership and of the finances that go into nursing homes. And that is really critical in order to achieve the good care that residents need and deserve, as well as the staffing standards that we're advocating for. And so we'll be talking about that today as well. So our partners today are AARP, and I'm going to turn over to Rhonda Richards to say a few remarks and introduce today's speakers. Rhonda?
Thank you very much, Lori. Good afternoon. I'm Rhonda Richards, Senior Legislative Representative in Government Affairs at AARP. I handle AARP's federal advocacy regarding care at home and in the community and in nursing homes, and support for family caregivers who are assisting their relatives and friends. AARP is pleased to join National Consumer Voice for Quality Long-Term Care in co-hosting this briefing. Thank you to all the Hill staff and others who are attending this afternoon. I'm going to say a few words and then introduce our speakers. The devastation of COVID-19 has highlighted long-standing challenges in nursing homes, such as insufficient staffing and the need for transparency and accountability that the pandemic exacerbated. Around the State of the Union this year, the administration proposed a wide range of nursing home reforms, including establishing federal nursing home staffing requirements after conducting a new research study to determine the level and type of staffing needed to ensure safe and quality care. AARP and many other stakeholders recently responded to a Centers for Medicare and Medicaid Services request for public input on minimum nursing home staffing requirements to help inform future proposed regulations on this. This afternoon, you'll hear about why minimum staffing requirements are important to quality care for nursing home residents. The administration also proposed a range of reforms on nursing home transparency and accountability. This is important for helping to ensure quality care, for consumers and their families to help them make informed decisions when selecting a facility, and for American taxpayers. In recent years, nursing homes annually received more than $50 billion from Medicaid and more than $25 billion from Medicare. You'll hear about proposals to help make important information more transparent and hold facilities more accountable for providing quality care. All nursing home residents should receive quality care. Transparency and accountability are essential to make sure taxpayer dollars are used appropriately, such as for resident care and staffing. This spring, the National Academies of Sciences, Engineering, and Medicine issued a consensus report on nursing home quality with many recommendations, some of which are similar to administration proposals. We'll hear about the report from one of the members of the committee who authored it and how it supports the need for change. We'll also hear, importantly, from a resident and family member on the front lines as they share their experiences. AARP was encouraged earlier this year to hear the administration describe new actions to ensure that residents in nursing homes will receive the safe, high-quality care they deserve. AARP urges the federal government to act swiftly to ensure minimum staffing standards, increase transparency, and hold nursing homes accountable when they do not provide quality care. Some of these proposals can be done administratively, such as through the Centers for Medicare and Medicaid Services, or CMS, and some would require action by Congress. You will hear more about some of these proposals today and why they are needed. Now I will briefly introduce our panelists in the order they will speak. Charlene Harrington is Professor Emerita of Nursing, Gerontology, and Sociology at the University of California, San Francisco. She was elected to the American Academy of Nursing and the National Academies of Medicine, has written over 250 articles, and is an expert on nursing home staffing, ownership, financing, and enforcement. Nina Cohn is the David M. Levy Professor of Law at Syracuse University and a distinguished scholar in elder law with the Solomon Center for Health Law and Policy at Yale Law School. She's affiliated with Syracuse's Aging Studies Institute and is a member of the American Law Institute. Her research focuses on elder law, including issues related to long-term care and nursing home quality. Jasmine L Travers is an assistant professor of nursing at New York University Roy Myers College of Nursing. Her career is dedicated to conducting research aimed to improve health outcomes and reduce health disparities in underserved older adults using both quantitative and qualitative approaches. Her current work focuses on mitigating disparities in appropriate access and use of in-home and facility-based long-term care for older adults. Most recently, Dr. Travers served on the National Academies of Sciences, Engineering, and Medicine Committee on the Quality of Care in Nursing Homes, which just released the widely anticipated report entitled The National Imperative to Improve Nursing Home Quality. Cindy Napolitan is a nursing home resident in Texas who has resided at 2 different nursing homes over 4 years and experienced life in a nursing home before and during the pandemic. Cindy has been very active and has served as resident council president. Our final speaker is Loretta Colantonio, a retired pharmacist from Gaithersburg, Maryland. Her late mother, Rita, lived in a Maryland nursing home for the last 4 years of her life. Loretta is joining us to share her experiences with us. We'll start with Dr. Harrington speaking about staffing.
Thank you very much for the opportunity to speak with you today. The first major improvements in nursing home quality and regulations were made with the passage of the Nursing Home Reform Act in 1987. And as was mentioned, the act requires nursing homes to have sufficient staff to meet the needs of residents, but it did not require minimum direct care staffing levels. In 2001, the CMS issued a seminal study that showed the need for a minimum of 4.1 nursing hours per resident per day, including 0.75 registered nurse hours to prevent harm or jeopardy to residents. And since then, many research studies have verified the minimum standard, and many experts and professional associations have supported establishing minimum nurse staffing standards, as well as 24-hour per day RN coverage. And a new 2022 report, as mentioned by the National Academies of Science, Engineering, and Medicine, also calls for increased staffing and a minimum staffing standard. We were very excited with President Biden's proposal in February to establish a minimum nurse staffing requirement and to create career pathways to good paying jobs. And as part of this effort, CMS recently asked for public comments on establishing this minimum staffing standards. Of course, there's very strong evidence that supports the minimum staffing standards. Nursing services are the core of the nursing home and provide services for both short and long-term residents. And higher staffing levels, especially RN staffing, improve resident outcomes, and it reduces common problems such as pressure ulcers, weight loss, the use of antipsychotics, infections, falls, rehospitalization, adverse outcomes, and it even improves mortality rates. And during the pandemic, we know that low nurse staffing levels were associated with COVID-19 resident infections and deaths. And the failure to establish these minimum staffing levels has led to resident disparities, because nursing homes with higher percentages of racial and ethnic minorities are more likely to have lower registered nursing levels and poorer quality of care. And nurse staffing levels are simply too low, and they're continuing to decline. Prior to the pandemic, only 25% of nursing homes met the CMS recommended 4.1 nursing hours per resident day. And for-profit nursing homes are the ones that have the lowest staffing levels compared to nonprofit and government facilities. Currently, registered nurse staffing and total staffing levels are even lower than they were prior to the pandemic. We also know we need 24-hour RN coverage, but the federal regulations allow for only one RN to be on the day shift. And yet RNs are essential because they're trained in infection control, resident assessment, care planning, emergency care of residents, and supervision. In addition, we know that nurse staffing levels and skill levels need to increase as resident acuity needs or the care needs increase. And this is required according to regulation, but CMS has not enforced the requirement. Medicare also pays higher rates for residents that have higher acuity, but it doesn't require the nursing homes to actually spend the money on the staffing. Now, the American Healthcare Association has mounted a national campaign against raising the federal staffing standards, and they have two arguments, neither one which we think are correct. First, they argue that they're unable to hire because of staff shortages. But the fact is that the shortages are caused by wage shortages, with the for-profit nursing homes paying the lowest wages and benefits. Nursing home wages are 15% below hospital wages, and nursing assistant wages are not competitive with other entry-level jobs. So nursing assistants are often living below poverty levels and have to work in multiple facilities. And the low wages cause social disparities, because we know that most nursing home assistants are women and 60% are from racial and ethnic minority groups. So nursing homes themselves, to deal with the shortage, need to raise the wages by at least 15%. Nursing homes also need to address other factors that lead to the shortages and high turnover rates, such as the heavy workloads, the inadequate sick leave and health insurance, and the inadequate staffing levels. The second argument that AHCA makes is that they can't afford to hire more staff. But research by AHCA researchers themselves show that it would only cost 4% of nursing home revenues to meet the minimum staffing standards. So nursing homes can easily absorb this increase. Many nursing homes were highly profitable during the pandemic, and Medicare and Medicaid programs increased the nursing home reimbursement rates during the pandemic. Plus, Congress gave extensive new money to nursing homes. Nursing homes are diverting money away from staffing and into profits and administrative costs. For example, in California, nursing homes spent only 38% of their revenues on nursing staff and 64% on direct care services. So they spent 36% of all their revenues on administration, profits, and profits in 2020. We also know that New York nursing homes are highly profitable. New York's new requirement for nursing home spending on direct care and its limits on profits would free up millions of dollars to pay for thousands of additional RNs and nursing assistants. Finally, nursing homes also have hidden profits that can be used for staffing. They often hide their profits and administrative costs by siphoning money into their related party organizations. Nearly 75% of nursing homes have related party organizations, and they've moved billions of dollars into these organizations. California nursing homes spent 30% of all their revenues in 2020 on related party organizations. So we think there's enough money in the system. We urge CMS to adopt a minimum staffing standard, which should be set at least at the level recommended by the CMS 2001 report. RNs should be required to be on duty 24 hours a day, and staffing levels need to increase to meet the needs of residents with higher acuity. So we strongly support the president's new reform proposals and the recommendations of the new 2020 National Academy of Sciences, Engineering, and Medicine report. Thank you very much.
Thank you very much, Dr. Harrington. Now we'll hear from Professor Cohn about transparency and accountability.
Thanks. So my remarks today are going to focus on the need for accountability to ensure that nursing homes are providing safe and humane care. I'll talk about how compliance and enforcement efforts can be reformed to create that accountability. And I'll talk about the role of transparency and transparency requirements. So as you know, the Federal Nursing Home Reform Act and its implementing regulations set minimum standards for quality and type of care provided by nursing homes that accept Medicare or Medicaid, which is virtually all of them. But unfortunately, the current enforcement scheme largely fails to hold nursing homes or their operators accountable for achieving those outcomes. And the gap between what is mandated and what providers are held accountable for has created a situation in which federal standards are often treated as aspirational goals and not true requirements. The result is that taxpayers don't get what they pay for, and that nursing home residents experience unnecessary suffering and premature mortality. So currently, the primary tool for holding nursing homes accountable is the state inspection process that's overseen by the Centers for Medicare and Medicaid Services, CMS. There's two key problems with it as I see it. First, too often inspectors fail to identify problems or assess problems identified as less serious or widespread than they actually are. And second, regulators rarely impose the type of penalties that would actually deter bad behavior. Instead, nursing homes found to violate federal law, including by endangering residents, are typically told just fix the problem. And sometimes inspectors don't even follow up to make sure it is fixed. So in this environment, unscrupulous providers can generate profit by operating facilities in ways that unlawfully endanger residents and staff. The current regulatory approach also suffers from a pretty major blind spot. Regulators treat each facility as if it's an independent entity, although many are part of regional, national, or even international chains. For example, an owner with a track record of bad behavior, even one resulting in other facilities being terminated from Medicare or Medicaid, can have new facilities certified for participation in these programs without consideration of the past record. And similarly, when determining what penalties to impose for a violation, something that's supposed to depend on how widespread the problem is, regulators don't really account for the fact that it may be part of a pattern of illegal behavior that's occurring across facilities. The good news is that there are some really concrete reforms that the federal government could implement to close this gap between what Congress has determined is necessary to protect nursing home residents and what nursing homes do. So first, regulators must impose meaningful penalties for violations of the Nursing Home Reform Act. Much can be done with CMS's current authority. CMS can impose a wider range of sanctions than it typically does. CMS could also stop waiving civil monetary penalties, especially where the underlying violations are serious or a part of a pattern of behavior across facilities owned or operated by the same entity. Congress also has a role here in ensuring that penalties are sufficient. Congress should, as President Biden has proposed, raise the dollar limit on the per instance financial penalties from 21G to $1 million. Second reform, Congress needs to enhance support for state inspections. The inspection process is at the core of protecting residents, and it needs resources. So Congress should appropriate funds to support this work, including to cover the rising cost of hiring the medical professionals needed to conduct the surveys, funds to provide inspectors with the training and the ongoing professional development that's really needed to properly identify the nature and the extent of violations, and to expand the special focus facility program that increases survey frequency for the worst performing homes and puts them on a route to termination from Medicare and Medicaid if there aren't improvements. Third reform, to increase accountability, Congress should require that regulators consider owners and managers' track records when determining whether or not to certify additional facilities. It's really rather outrageous that an entity known to operate other facilities in a way that is illegal, that fails to provide residents with the type and quality of care mandated under federal law, that causes residents to suffer unnecessarily and die prematurely because of that illegal behavior, can still have more facilities certified for Medicare and Medicaid as if none of this had happened. So Congress needs to step in here. It should require that the Secretary of Health and Human Services consider owner and operators' track records in determining whether their facilities should be certified. And Congress should also explicitly prohibit the Secretary from certifying facilities owned or operated by entities whose past conduct indicates that they're unlikely to administer a facility in a way that respects residents' rights and provides high quality care. Fourth reform, it's necessary to create transparency as to ownership and management. Key to holding people accountable is knowing who they are. But the growing complexity in ownership structures means that it's increasingly difficult to figure out who actually controls a facility or has beneficial ownership. So accessible and publicly available information about ownership and management would support the types of enforcement efforts I just described, also make it easier for state licensure bodies to consider track records when making licensing decisions. And it would allow consumers to make more educated choices and create stronger incentives for care through consumer choice. Increasingly, we know that nursing homes are owned by investment entities, private equity, real estate investment trusts, and a growing body of research shows that these ownership structures are associated with lower quality care. Consumers should be able to know if these entities are operating a nursing home that they're considering for themselves or for a loved one. And I will say President Biden's proposals in this regard, including a new database tracking owners and operators across states, implementation of transparency requirements, could be quite helpful. Final reform I want to highlight is that it's critical that the federal and government increase disclosure and transparency as to nursing home expenditures. As a 2016 study by the Government Accounting Office found, although CMS does collect information about nursing home expenditures, it hasn't taken the necessary steps to ensure that the data is accurate, complete, and accessible to stakeholders. Currently, the reality is you really need specialized software, programming skills, powerful computers to use this really dense and poorly organized information. In addition, the current cost report data lacks critical information about related party transactions. So as the same GAO study explained, nursing homes can conceal profit in management fees, lease agreements, interest payments to owners, and purchases from related party organizations, but it's not possible to detect that using the cost report data. And what this does is it enables facilities to divert money needed for care for residents to a related party, creating profit that appears to the outside world as an expense. So Congress should be appropriating funds to enable CMS to redesign the Medicare cost report system so that it is accessible, accurate, and informative. And that transparency would enable policymakers and taxpayers a window to evaluate the nursing home industry's claims that it needs more taxpayer money and cannot afford to meet various standards. Because the current data asymmetry, if you will, is allowing the industry to claim dire financial straits while private equity is snapping up homes as moneymakers. In addition, I think transparency could help consumers make more informed choices. In choosing a facility, I want to know, is this a home that spends most of their money on providing care? Or is it one that's diverting a lot of income into investors' pockets? So to sum up here, we have a situation in which nursing home residents are at risk because nursing homes aren't held accountable for providing the type and quality of care that federal law requires. And true accountability, I think, is going to require not only enhanced enforcement efforts, but far greater transparency with regard to ownership, management, and expenditures. So thank you for the time today.
Thank you very much, Professor Cohn. As a reminder, if you have a question to ask of the panelists, please put it in the Q&A and identify your office or organization. Now we'll hear from Dr. Travers about the National Academy's Nursing Home Report.
Thank you, Rhonda. It's a pleasure to be here. I just want to say a lot of the issues that Dr. Cohn and Dr. Harrington brought up are reflected in the NASEM report. So excited to also share those recommendations. So what I will do is provide some context to the report, provide some information about the recommendations, how the recommendations from the report are consistent with some of the reforms that came out of the Biden administration, and just end off by discussing how the report really supports the need for change in nursing homes. So for many decades, the quality of care in nursing homes has suffered as a result of underinvestment. 4 reports produced by the Institute of Medicine, now the National Academies of Science, Engineering, and Medicine, have had some relevance to improving care delivery in nursing homes. The last time a report focused entirely on the nursing home setting, however, was in 1986. In this landmark report, several recommendations were made to improve the care delivered to residents in nursing homes, but these have yet to be realized. Indeed, the way the United States finances, delivers, and regulates care in nursing home settings continues to be ineffective, inefficient, fragmented, and unsustainable. In 2020, a 17 expert committee, which included myself as well, was convened to examine how our nation delivers, regulates, finances, and measures quality of nursing home care, including the longstanding challenges brought to light by the COVID-19 pandemic. The committee was tasked with making bold but actionable recommendations for affecting the change that we desire in nursing homes, especially given the fact that there has been a report conducted in the past and the recommendations that were coming out of that report were still yet to be realized. The committee's vision was for nursing home residents to receive care in a safe environment that honors their values and preferences, meets goals of care, promotes equity, and assesses the benefits and risks of care and treatments. Recommendations can be found in the National Imperative to Improve Nursing Home Quality, Honoring Our Commitment to Residents, Families, and Staff report, which was released on April 6th of this year. They covered 7 themes. First, to ensure that nursing homes deliver comprehensive, person-centered, equitable care that ensures residents' health, quality of life, and safety, promotes autonomy, and manages risk, residents and families' preferences, goals, and values must be prioritized to help develop innovative approaches such as small home models. The report also emphasized the importance of strengthening emergency preparedness so that our country never has a repeat of the past 2 years. Second, there is a need to ensure a well-prepared, empowered, and appropriately compensated workforce by putting in place competitive wages and benefits, enhanced minimum staffing standards as shared by Dr. Harrington, and increased training that comprehends diversity, equity, and inclusion, along with education on geriatric syndromes, financial management, and leadership, for example. Third, too many nursing home operations use complex ownership structures to siphon dollars away from resident care. To increase financial transparency and accountability by nursing homes, policymakers must collect, audit, and make available detailed facility level data in a readily usable database on the finances, operations, and ownership of all nursing homes at any given time. Fourth, the report provides a strategy for moving toward a federal long-term care benefit that adequately covers comprehensive nursing home care. Medicaid is currently a default payer of nursing home care, but eligibility is limited by income and asset tests, and it's constantly subjected to state budget constraints. Fifth, a more effective and responsive system of quality assurance is needed for nursing homes. State agencies currently survey nursing homes under the direction of the Centers for Medicare and Medicaid Services, which was brought up before, to ensure that they are complying with the requirements to receive payments from Medicare and Medicaid. But the survey process often fails to identify or correct serious care problems, to prevent recurring problems, and to investigate complaints in a timely manner. Additionally, there's insufficient oversight or transparency in the survey process. As such, state survey agencies must be given adequate resources to increase monitoring of survey performance and of strategies to improve quality assurance. Six, it is essential to expand and enhance the measurement of nursing home quality and the assessment of quality improvement programs. Quality measures that reflect what residents and families experience and want from nursing homes must be developed and reported. The quality of care is particularly concerning for several high-risk populations, such as racial and ethnic minoritized individuals, those who identify as LGBTQ+, and those who experience significant disparities in care. Recommendations for the development of a health equity measure are also included in the report. Seventh and finally, financial incentives must be used to support the adoption of health information technology in all nursing homes, which can contribute to increased efficiency in care delivery, enhanced care coordination, improved staff productivity, promotion of patient safety, and reduce health disparities. So next, thinking about the consistency between the Biden administration proposals for nursing homes and the NASEM report. So the Biden administration recommended several reforms for nursing homes that were very similar to the committee's recommendations. And they included recommendations around the sufficient number of staff who are adequately trained, establishing a minimum nursing home staffing requirements, accountability of poorly performing nursing homes and how they are made to be responsible for that poor performance, improve transparency for the public on nursing home conditions so that the public can make better choices when it comes to nursing homes, adequate funding of inspection activities. So again, for those surveyors, so that they're able to really do the work that they need to be doing when making sure that nursing homes are providing the optimal quality of care. Increased scrutiny of the poorest performers, making sure that those who are performing poorly, understanding why they're performing poorly, if it's just bad actors or if it's something where support is additionally needed. A provision of technical assistance to nursing homes so that quality improvement can be enhanced within nursing homes. Again, the transparency of ownership of nursing homes, which was brought up before. Affordable nurse aid training. So both reports talking about how do we increase access to training for CNAs specifically. Within our report, our recommendation focused on actually making nurse aid training free for CNAs. Support of state efforts to improve staffing and workforce sustainability, so recruitment, retention, and really identifying quality indicators when it comes to recruitment and retention. So including racial and ethnic demographics of those who are leaving the workforce, those turnover numbers by those demographics, as well as job satisfaction indicators. Launching a national nursing career pathways campaign. So understanding, especially for groups such as certified nursing assistants, people who leave the workforce, pay has been a big issue, but understanding that there are other issues within the nursing home setting that cause individuals to leave, one with thinking about career advancement, and then enhanced requirements for pandemic and emergency preparedness. So there have been requirements for nursing homes to have plans for emergency preparedness, but that's something that we enforce within our recommendation when thinking about having those plans actually in place and reviewed on a continuous basis, and having additional supports within the community, local, state levels, to ensure that nursing homes are part of the emergency response initiatives. Although Biden's reforms provide a start for improving care in nursing homes, much more comprehensive and system level action is necessary to transform the situation. So the committee's report provides this comprehensive detail. So some ways in which the report supports the need for change. The report emphasizes that federal and state governments, nursing homes, providers, payers, researchers, the public, and others need to demonstrate a shared commitment to the care of nursing home residents. And concurrently, all relevant federal agencies need to have authority and resources from the United States Congress to implement the recommendations of this report. And that's something that we emphasize. And I know as people reviewed the reforms from the Biden administration and also recommendations from our report, really scrutinizing those recommendations, asking where is the money coming from, but us emphasizing the needs for the relevant agencies to have the authority and resources to implement these recommendations. Another big thing was in the implementation of these recommendations is that extreme care needs to be taken to ensure that initiatives intended to improve quality do not in fact exacerbate disparities in resources, quality of care, or resident outcomes, which has typically been the case. So thinking about those unintended consequences when you put recommendations in place for those nursing homes who have struggled, not because that they're doing anything intentionally wrong, but just because that they don't have the supports that they need. The committee additionally highlights that high quality research in a number of topic areas, including the minimum staffing standard, systemic barriers to improve staff recruitment, effective care delivery models, and policies to address disparities is needed to advance the quality of care in nursing homes. And we've seen that more research and just more requests for information has come out, like Dr. Harrington has said, from CMS with regards to understanding minimum staffing standards, as well as the development of a health equity measurement. And then to facilitate the process of implementing these recommendations, the committee categorized each of the component of the recommendations into an estimated implementation timeline, which is available on the NASM website. So for instance, we categorized recommendations that could be implemented immediately, such as documentation of residents' preferences in the care plans, short-term, such as minimum education and national competency requirements for all staff, intermediately, such as incentives to support innovative, smaller home-like designs, things like private rooms, for example, and long-term, so promising pathways to reduce or eliminate disparities. The committee was also explicit about the actors who we believed should be responsible for implementing specific recommendations. And just to add another layer to that, we've been very committed to the dissemination of this work and just providing additional context, doing additional research with regards to the recommendations. So we provide information for relevant stakeholders to be able to implement these recommendations. And a number of those products are coming out through a number of mechanisms. So op-eds, manuscripts, through different webinars, conference presentations, podcasts, etc. So definitely more information with regards to how we can best walk out these recommendations, because there's a number of layers to it. But in conclusion, it is the belief among the committee members that implementing the committee's recommendations in its totality, so not just one or another, will go a long way toward making high quality, person-centered, and equitable care a reality for all nursing home residents, their chosen families, and the nursing home workforce. Thank you.
Thank you very much, Dr. Travers. Now we'll hear from Cindy Napolitan.
Good afternoon, and thank you for the opportunity to speak to you about what it's like to be a resident in a nursing home. My name is Cindy Napolitan, and I live near Dallas, Texas. My daughter and I were diagnosed decades ago with multiple sclerosis. We were cared for by my husband until his sudden death in 2017. My son attempted to care for us, but it was soon clear that we would need to seek long-term nursing care. It was a difficult process to find a facility and to transition to a new living situation while grieving all we had lost. We've lived in several facilities for over 4 years. Nursing homes have resident councils that meet regularly to talk about issues and concerns. The number one concern is always the lack of staffing. Allow me to provide several examples of what I have experienced. Imagine your mother is brought to the dining room where she waits several hours to eat because there's not enough kitchen staff to fix it or aides to serve it. And for those unable to feed themselves, even a longer wait. Staff shortages in housekeeping means there's no clean bedding or towels, so your husband doesn't get showered or bathed. If a resident needs to have a diaper change, they turn on their call light and wait for an aide to answer. It could be hours. Imagine your daughter laying in her own filth. Last fall at 4:30 in the afternoon, I witnessed my aide reporting to my nurse that a patient was not waking up. The nurse said they would check on the patient as soon as possible. At 7 o'clock, the nurse calls out code. CPR is started and paramedics arrive. After an hour, the paramedics leave the room. My neighbor, someone's loved one has died. These examples of staffing problems are the reason why you need to establish minimum staffing requirements, patient to caregiver ratios, and written standards of care. A second concern is properly trained staff and continuing education. A resident gets used to being cared for by a familiar face. They learn their likes and dislikes, and the resident learns to trust the caregiver. This is especially true for memory care residents. If there's high turnover, there's not enough time and resources to properly train a new caregiver. In my facility, certified nursing aides are required to have 2 people operate the Hoyer lifting equipment. When my daughter is picked up and transferred with this lift, it's only one person, and sometimes she has to explain to them how to operate it. I'm able to use a sit-to-stand lift, and I've had to train them myself as to its operation. Establishing extensive continuing education is vital to the safety and well-being of every resident. Thirdly, my facility is nicely decorated with beautiful furniture and artwork. During the holidays, 8 Christmas trees are professionally decorated. Tours are given to possible residents and their families. They see the beauty of the outside, but don't get to see what really happens on the inside. Would you rather send your family member to a beautiful facility or to a long-term care facility that uses your Medicare and Medicaid tax dollars to improve patient care and to help ensure their quality of life? Establishing transparency of facility ownership and finances would help you answer that question. As you can imagine, passing this legislation is of utmost importance to me, my daughter, and my fellow residents. I hope I have provided enough examples to show you the importance of staffing standards, adequate training, and fiscal accountability. I appreciate your time and consideration.
Thank you very much for sharing your experiences with us today. Now we'll hear from Loretta Colantonio.
Hi. My name is Loretta Colantonio. My heart is broken and I am furious. My mother, Rita Colantonio, died in a Maryland nursing home last month at the age of 89. She deserved to die with dignity while receiving high-quality care from staff. Instead, my mother's nursing home experience was horrendous for her and a nightmare for my family. Let me tell you our story. I'm a retired pharmacist. I was a caregiver for my mother in my own home for about 3 years until her dementia became too severe. At this time, about 4 years ago, my sister and I made the difficult decision to move Mom into a nursing home. Either I or my sister visited Mom every day, and towards the end, we were both there around the clock. I tell you this so that you know that we were not an absentee family. We were a constant presence at the facility and in our mother's life long before the COVID-19 pandemic began. We saw a level of care that was shocking in its inadequacy. It included staffing issues, signs of neglect, and a general lack of communication and information from staff and ownership. I could hardly keep up with who was in charge because new points of contact were not provided to us, even when we asked repeatedly. During the early days of the COVID-19 pandemic, the facility was ill-equipped and unprepared. My mother caught the virus twice. Although she recovered, the nursing home was slow at providing us with COVID-19 updates, and the staff did not wear personal protective equipment initially. In those days of the lockdown, I could only see her by looking at her through her bedroom window from the parking lot. The staff told me that had to stop. We went for days on end without being able to get my mother on the phone. But it's important you know that this facility wasn't fully staffed even before the pandemic. And after a change of ownership, many staff quit. My sister and I saw firsthand the pain and suffering caused by such inadequate staffing. In her final days, my mother often cried out enduring long periods of pain because there was only one nurse to administer the medication she needed to bring her some measure of comfort. That nurse was caring for 30 residents. How can one nurse possibly care for 30 residents? Mom died of pneumonia. I felt like the nursing home had abandoned her. My mother's experience was horrendous. This is not the way it should be. We, as a country, need to do more to care for our elderly. Judging by the quality of care my mother got, it seems like we throw away the old in this country. It's a disgrace, and it's been happening long before the pandemic. Significant reforms and improvements must be made, especially when it comes to staffing in nursing homes. My mother, Rita Colantonio, deserved better. All American seniors deserve better. Thank you.
Thank you very much for sharing your experience with us today. Now I'm going to turn it over to Lori for Q&A moderating.
There we go. I was muted for a second. Thank you so much, Rhonda. And thank you so much to all of our speakers for your excellent and powerful testimony, and particularly to Cindy and Loretta for the powerful statements and experiences that they and their families have been undergoing. Their stories are not unique. We hear from many, many residents and family members who tell similar stories about the inadequate staffing, the lack of supplies, the lack of resources that are available, and where residents are not getting the care that they need, and staff are finding themselves in untenable positions where they're needing to care for 20, 25, 30 or more residents at a time, and that's just not sustainable. So we, let's see if we have some questions for our speakers here. So let me start with a question to our panelists that ask, how would enhanced transparency and accountability help nursing home residents, prospective residents and their families, and protects taxpayer dollars? And either Dr. Harrington or Nina or Dr. Travers, would one of you like to start on that question? I know it was addressed somewhat in the comments.
Well, I mean, I can start. I would say, look, if I'm trying to figure out what nursing home I'm going to choose for myself or for a loved one, I want to know, what is that nursing home spending money on, right? Is most of the money going to direct care staff, right? We know that staffing is the best indicator of quality of care, or is a lot of it being diverted? That is a very useful and straightforward data point that consumers can understand readily and use to make decisions. Similarly, I think consumers should know, is this a home that is really an investment vehicle? Is this a home owned by private entity? Is this a home that's really being run as part of a real estate investment trust? That helps you know, what are the priorities here? And I think consumers can understand and utilize that information.
Thank you, Nina. Anyone, Charlene or Jasmine, would you like to respond or add anything to that question?
Sure, I just want to add that there's recommendations from the report to have funding directed towards resident care and specifically staffing. But at the same time, knowing that there needs to be increased funds to the nursing homes as well. 3 states have made a commitment to require funds be directed towards resident care, and then New York specifically requires a specific percentage, I believe it's 40%, to go towards staffing. And we'll see how, really that translates. But an issue with that, which is another thing, is actually finding the people to be able to fill those positions and such as well, when thinking about the minimum staffing standards that have been implemented in some of these states.
Mm-hmm. Thank you. So another question is, how would you respond to concerns raised by nursing homes about minimum staffing requirements, specifically that there are not enough workers for the jobs, there's a workforce shortage and crisis, and reimbursement, especially from Medicaid, does not pay enough to hire and retain staff? And I know that Dr. Harrington addressed some of that in her remarks, but other thoughts about that question and how we might respond to it?
I think it's very clear that the nursing homes need to increase the wages. If they're going to retain staff, they need to look at improving the wages, the benefits, and the working conditions. And this requires resources. But we do think that there's adequate resources for nursing homes to do this at this time, because when you look at the data that we have available, we can see that a lot of it is going for administration of profits and property costs, and it's not really being used for the resident care.
Mm-hmm. Thanks, Charlene. Anyone else want to respond to this?
Oh, because New York, again, we're going through this. There has been a minimum staffing standard kind of put in place, and nursing homes have had to become, more creative and innovative in where we get those individuals to work. So, for example, there's a nursing home organization within New York that has started to cross-train individuals that are already within the nursing home setting. So housekeepers, recreational therapists in this short-term time. So how do we actually kind of get people that are already within our institution, organization, to be able to work these different positions? But then also the career advancement opportunities. So CNAs to be able to advance to LPNs and get that education and so forth. And just it's an issue because nursing homes, the staffing challenge is severe. Nursing homes have had to close rooms because they don't have sufficient staff and still are working short staff. So another recommendation, and I was saying this before, is that we are calling for increased funding for nursing homes so that they're able to put those funds towards, the recruitment and retention of staff, and then also being able to change their work environments of which staff are working in, and thinking about just competitive wages and the disparities that we see between not only settings, but disciplines. So if an Amazon worker can get $18 to $22 an hour with benefits as well, not have all the demands, why work in the nursing home setting? Or if in the acute care setting, a registered nurse can get $10,000 more, why work in the nursing home setting? So we have to also consider that, and that's part of our recommendations as well.
Mm-hmm. Thank you. Let's see here. There's a question related to whether there are any studies around nursing staff turnover, and I think there are. Charlene or Nina?
Yes, there are a number of studies around turnover, and CMS is now putting the turnover rates up on their nursing home compare website. So the average turnover rates are about 50% for nursing staff, and that's way too high. We saw during the pandemic that nursing homes that had high turnover were more likely to have COVID infections. So nursing homes really need to work to get the turnover down, and that would address part of the staffing shortage. But in order to do that, they have to address these wages and working condition problems.
Mm-hmm. Another question that came in is, as you know, we've been talking about these different issues. Some of the conversation has focused on for-profit nursing homes and corporations and things like that. But how would we recommend addressing staffing for nonprofit nursing homes, or would there be any different recommendations?
Well, nonprofit nursing homes generally have significantly better staffing, and they have lower turnover rates. And that's because they pay higher wages and benefits. So they tend to have much more stable staff. And so we don't see as many problems with the nonprofits. And that's partly because they're not trying to make extra profit. So they're more likely to be investing in their staff.
Thank you, Charlene. I know we're coming close to the end of the program today. I wanted to give Rhonda an opportunity to make any final remarks before we close out. Rhonda?
Sure. Thank you very much, Lori. I want to sincerely thank all of our speakers this afternoon for their time and willingness to share their expertise and their firsthand experiences. We hope the speakers have helped explain the urgency of why the administration and Congress must act to protect our nation's nursing home residents, including by ensuring federal minimum nursing staffing standards to help all residents get the care they need, regardless of the state, zip code, community, or facility that they reside in, and also ensuring transparency and accountability for owners and operators and finances. And we urge your support for these necessary reforms in these areas. Ensuring equity and addressing disparities is also essential to quality care. And action by the administration and Congress can help make sure that nursing home residents receive the quality of care and quality of life that they need and deserve. Residents deserve better. Thank you again for taking the time to join us this afternoon. And now I'll turn it back over to Lori for her closing remarks.
Thank you so much. And I echo what Rhonda said in terms of thanking our distinguished panel of speakers today. I think the remarks were very powerful and really got to the crux of what a lot of the issues are. We know that inadequate staffing levels lead to poor care for residents and inadequate care. And really what this does is leaves an unfulfilled promise, an unfulfilled mandate and promise for residents who should expect to receive care and services to help them attain or maintain their highest practicable level of well-being. That's in federal law, and it's something that we cannot forget. But our current policies and lack of transparency and accountability allow those providers that are unscrupulous and focused more on profit to really put that design and effort to obtain profit and money before patient care. And that, again, is unacceptable. So we cannot continue to perpetuate these poor care practices, poor quality jobs, racial disparities, and lack of quality care that residents are receiving right now. So we also urge Congress to support the implementation of the proposals introduced by the Biden administration and to do their part in passing legislation that would also help further us in reforming nursing homes in order to ensure that residents are receiving the best possible quality care and quality of life. So thanks to all of you for joining us today. Thank you so much to our partners at AARP and the team that's been helping support the webinar in terms of planning and in operations today. Thank you all so much. Again, the recording and the statements will be shared with those who are participating, and they'll be also posted on our websites. And we look forward to engaging you again in the future. Good afternoon.